Cardiomyopathy is a disorder that affects the heart muscles, causing them to enlarge, thicken, and become weakened. This causes improper blood flow through the body, which can lead to heart failure and arrhythmias. There are four main types of cardiomyopathy: dilated, hypertrophic, and restrictive. Dilated cardiomyopathy, abbreviated as DCM, is when the heart's ventricles enlarge and weaken, causing a decrease in ejection fraction. Ejection fraction is the amount of blood pumped out with each heartbeat. As you can see by this picture, the right ventricle is dilated. As time goes by, it can affect the other heart chambers. People with DCM can have no symptoms to severe symptoms that may worsen, but symptoms include swelling of the lower extremities, fatigue, weight gain, fainting, dizziness, chest pain, and blood clots. DCM is genetic. However, there are other factors that can lead to it, such as diabetes, thyroid disease, alcoholism, viral infections of the heart, and coronary artery disease. Doctors base your diagnosis off your medical history, physical exam, blood test, chest x-ray, electrocardiogram, CT scan, MRI, exercise stress test, echocardiogram, and cardiac catheterization. Treatment may have to include a combination of surgery and medication. Surgery involves a pacemaker, or a cardioverter defibrillator. Medication includes angiotensin-converting enzyme inhibitors, angiotensin receptor blockers, and beta blocker. Hypertrophic cardiomyopathy involves the thickening of the heart muscles, mostly at the septum, which leads to abnormal blood flow. As you can see by this picture I drew, the septum is very much enlarged. Symptoms for HCM vary from person to person. The patient may have no symptoms or severe symptoms. However, symptoms include chest pain, fatigue, shortness of breath, fainting, and in some cases, sudden death. The cause of HCM is unknown. However, it is genetic and may be acquired due to high blood pressure or aging. Diagnosis includes taking a look at the patient's medical history, giving them a physical exam, blood tests, echocardiogram, chest x-ray, CT scan, and MRI. The treatment for HCM varies on the condition of the disease, such as how the heart is functioning, if arrhythmias are present, and if the blood vessels are narrowed. However, doctors' treatment is to aim to prevent symptoms and complications. Medication can be prescribed, such as beta blockers and Lipressors. There are some cases when medications are ineffective and surgery is needed. Surgery options include septomyectomy, which involves an open heart operation in which the surgeon removes the thickened septum, which will improve blood flow. There is octoseptal ablation, which involves injecting alcohol via catheter into the artery supplying blood to the heart, thus destroying the thickened heart muscle. A pacemaker implantation may also be needed. The pacemaker is inserted under the skin, sending electrical signals to the heart in order to monitor and regulate the heart. Lastly, there is an implantable cardioverter defibrillator, ICD, which involves implanting the ICD in the chest. When an arrhythmia occurs, the ICD sends calibrated electrical shocks in order for the heart to return to normal. Treatment may also include lifestyle changes, such as a change in diet or more physical activity. Restrictive cardiomyopathy is uncommon. It is when the ventricles of the heart are rigid and lack flexibility, which creates difficulty for the ventricles to fill with blood and pump it back out, leading to heart failure. Like the other types of cardiomyopathy, symptoms vary from person to person. There may be no symptoms or there may be extremely severe symptoms. However, symptoms include shortness of breath, fatigue, inability to exercise, swelling of the lower appendages, weight gain, and nausea. The cause of restrictive cardiomyopathy is unknown and is usually not inherited. However, causes of it may include buildup of scar tissue, buildup of proteins, excess iron, radiation exposure at the chest, and other systemic diseases. Diagnosis of the disorder are similar to the other types of cardiomyopathy, which includes medical history, physical exam, blood tests, chest x-ray, echocardiogram, electrocardiogram, CT scan, and MRI. Occasionally, a myocardial biopsy is done, which involves taking a sample of the heart tissue and examining it under a microscope. Treatment focuses on improving symptoms and preventing complications. The doctor will pay attention to the patient's sodium and water intake and monitor his or her weight. If there are issues concerning sodium and water intake, diuretics may be prescribed.